Good morning, everyone. Lately, the number of heart attack cases in 30 and 40-year-olds have been on a rise. So what are the warning signs that we should be looking out for? Heart attacks in teenagers and adults. Is family history also a factor in increasing heart attacks amongst the young? Are COVID vaccines linked to heart issues in teens and young adults? To answer all of your queries, we have invited Apollo Senior Consultant Cardiologist, Dr. Vijayachandra Reddy, with over 25 years of experience in the field. He'll talk about various heart diseases and how they can be prevented. So don't miss out on today's special episode of the Health Hour series. See you guys at 11 a.m. on Apollo 24/7's Facebook page or YouTube channel. Join with your friends and family and ask all your questions live. The link is given below. See you guys soon.
It's always been there, standing between you and your health. A wall, between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste and a warm welcome to all of you. This is Vidya Malavde and I'm super excited to be a part of this one-of-a-kind live health hour show, which has helped so many viewers connect with leading Apollo experts even during the most difficult. Through Health Hour, 24/7 aims to bring the best doctors from Apollo Hospital to your homes every Sunday so you can discuss your health concerns and get answers to all of your health related queries live. And if you want to avail the entire range of services by Apollo Hospitals from the comfort of your home, I strongly urge you to download the Apollo 27 app, Apollo 24/7 app. You book virtual consultation, best Apollo doctors, order your medicines online, and even get home sample collection of your lab tests, all with Bus Ek tap. Let me also tell you about Saving a Child's Health initiative, Sachi, by Apollo Foundation that aims to provide the best pediatric care to children in need at no cost. So if you wish to know more about it, please check the link in the description box or scan the QR code on. Coming back to the show. Today we are here to discuss a very important topic, heart attacks amongst the youth. I'm sure all of you have a lot of questions like why are heart attacks on the rise in young people? Can lifestyle and diet help prevent them? And what millennials need to know to stay heart healthy? To answer all of this and more, Dr. Vijayachandra Reddy, consultant and interventional cardiologist at Apollo Hospitals Greams Road, Chennai, here with us today. So start typing your questions and we will take them up with Dr. YVC Reddy one by one during the course of the show. Also, watch out for the quiz right after the live Q&A session where you can win tips, discount vouchers, and so much more. Well, what can I say about Dr. Reddy? He has over 25 years of experience in performing invasive cardiological procedures, fellowship of American College of Cardiology, pioneer in robotic angioplasty, transradial interventions, and complex high-risk interventions, versatile in coronary imaging, implantable cardiac device therapist, thoracic and abdominal aortic endovascular stent grafting, recipient of several professional awards and gold medals, key thought leader with several contributions to interventional cardiology in national and international fora. Dr. Reddy, we're
Thank you,
very happy
Vidya.
to have you on board today. It's such a pleasure that you can join us. Honor talking to you. So, welcome on board the show.
Thank you very much, Vidya, for having me on this show. It's a wonderful Sunday over here in Chennai, and I'm very delighted to be sharing this platform today.
So, so yes, let's get right into it. I have a few questions. We have so many questions coming in from our viewers as well. So let me jump into it. You know what? I think when I was growing up, heart attacks and heart disease was actually related to the older generation. How is it that now we're seeing so much of it in the younger people?
Yeah, see, heart disease itself was known very well to humankind long back, millennia years ago. In fact, if I have to quote 3,500 years back in the Egyptian papyrus, someone has written, if you come across someone who says he has some discomfort in the chest or shoulders, tell him he's threatened by death. This was well recognized a disease long back. But what has changed is we now know why it is happening. We now can diagnose it very well and we can treat it extremely well. And probably we have come to a stage where we know how to prevent it as well in a majority of cases. And that is the essence of the today's talk going to be. And you rightly said this heart attacks used to be a disease of the elderly age, old age, maybe
Yeah.
65 plus age group. But sadly, we are seeing it more often in the youngsters. That is a real tragedy. But again, we do know why it can happen and how we can prevent it. For the sake of today's discussion, I think let us say the cutoff point youth as probably 45. So we will confine mainly to see why the heart attacks are happening in the below 45 engaged group and what can we do about it.
Absolutely. So, what are the how common is heart attack in the young? First of all, let's begin there.
See, if you take the heart attack as such, of course, we as India sadly are the diabetic and heart attack capital of the world. And surprisingly, people less than 45 getting heart attacks, I think we top the world in that. If you see our ICUs, we
Oh my
find
God.
that about 40% of our patients are below 45, which is sadly not reflected in any other part of the world. No one knows the reasons, but probably the biggest reason is probably in the genetics. Of course, there are other reasons which we'll be discussing along. It is a sadly big magnitude problem, a big societal healthcare problem for us. 40% in youngsters having heart attacks is a biggest tragedy.
So, okay, just to get my understanding right, when you say genetics, does it mean hereditary anyway? Does it really?
See, scientifically, we have not progressed to a stage where we could take a blood sample and say you have a genetic change in this chromosome, and that's the reason you might get more heart attacks. We are on that path. In fact, there are about 20 genes which can be identified, but it is too premature to use that on a clinical basis.
To
So,
talk about
one
this.
thing is for sure,
Correct.
if someone in the family has a heart attack, in a male below 55 and in a woman below 65, we call it as premature heart disease. And if you have any such history in the family, indirectly it means that you are genetically prone. So, in fact, if you ask me what is the strongest
Wow.
risk factor for heart diseases or heart attack, a premature heart disease history in the family is very simple. In fact, it just is a question. In fact, I keep telling, if you do all your health checks and you perfect normal, but you someone rings up from your family saying that your cousin who was 52 has developed a heart attack yesterday, you know that you belong to the highest risk group as well. That is the importance of genetics. But
Oh
this
my
one
God.
simple family history is good enough a warning signal to tell you that at least you can do some preventive strategies.
I think I'm quite aware, but I had no idea about this. Thank you so much for enlightening me, viewers as well. So, to just begin with, so why do young people get heart attacks really?
See, the basic disease which makes people prone for heart attacks is atherosclerosis. That means the cholesterol, which is a normal component of the human body, which every cell needs,
Right.
somehow gets chemically modified and gets deposited in the arterial wall. As long as it just gets deposited and causes mild thickening, there's no issue. In fact, some deposits are known to happen for all of us from right from 6 years of age. We call them fatty streaks. They are not pathologically important, but as they build up more and more, and beyond a certain limit, they become bigger, and the wall gets thickened. And where if that happens, and if the plaque we call it, if it ruptures, then is the catastrophe.
Correct.
The cholesterol deposits are exposed to the blood column, and as you know, any injury for us, the blood clots within 5 to 10 minutes. So the same process can happen inside the blood vessel, and in 5 to 10 minutes, someone who is a perfectly healthy person can potentially become a catastrophic enter into a catastrophic scenario. That is the problem of this disease. The entire crux of the problem is the basic cause of atherosclerosis is not uncommon, but the trigger which causes the plaque rupture and then the blood clot causing interruption to blood flow can be quite devastating.
Oh my God. Okay. So, what are the risk factors, especially in the young people with heart attack?
See, I should quote one study, a beautiful study called the Interheart study, which is very useful for the audience to know. What was done in this study was 5 continents across the world, people who are coming in with the first heart attack. First heart attack is always a very important thing. So when you see them and then see what are the reasons why they were coming into the hospital, they were all perfectly healthy people till that time in terms of heart disease. In fact, anyone who gets a first heart attack, the first question they say is, I was healthy till yesterday or even till morning. And that is the truth. The technically, if you use the language, the first heart attacks always happen in previously perfectly healthy people. So this is a very important study because it identified 9 factors which are very easy to understand. These 9 factors make one prone for getting into heart attacks. What are the 9? Simple things: high blood pressure, overweight, cholesterol problem, sugar problem, sedentary lifestyle, psychosocial stress, smoking, and of course, lack of adequate exercise, lack of adequate healthy diet, and the 9th factor is a little bit controversial: lack of moderate alcohol usage. That was the least, of course, important. All these 9 are supposed to be pushing one into a heart attack. And if you see this,
So, are
majority
you
of it
telling me
is
that actually? Sorry, go ahead, doctor. Of course.
no, no, majority of these 9 factors, what I was saying, is just by history. You know it yourself. Inadequate diet, psychosocial stress, sedentary lifestyle, smoking, overweight. They're nothing. Everyone knows about it. Only 3 parameters need to be measured: the blood pressure, which takes 10 seconds, and the cholesterol and blood sugar level, which takes just half an hour to know the answer. So these risk factors are nothing great
Correct.
or new. They are easy for anyone to know it.
So, how often does one keep doing the blood pressure check and the blood sugar checks on ourselves?
very important question raised. This is the paradox
This
of
is something I want to know because I should start.
this is the paradox of illness versus wellness. See, if you identify these blood pressure, sugar, cholesterol, that tells you only about the illness. But what we have to look at is the wellness component of it. Are you doing good, adequate exercise? Your
Yes.
habits are good. Your adequate healthy diet. What we'll discuss about the adequate healthy diet, what a heart healthy diet means. So the wellness criteria are very important. See, you might have normal blood pressure, normal sugar, normal cholesterol. But if you're not doing the other jobs, so the wellness score is not good. In fact, to quote, one study was done
Right.
in a county in US. 2,000 youngsters were evaluated for the wellness scores. Are they doing good exercise? Are they avoiding smoking? Are they taking the right diet? Are they avoiding psychosocial stresses? Only one out of those 2,000 had met these five wellness criteria. So that is the sad part. You might know about the disease, just not having
Wow.
a disease today does not mean anything. You have to have the wellness factors built in as well.
Absolutely. I think that kind of that 5 level test is what I'm going to be taking next with you after we finish this. But well, moving along, I want to say, so what can the triggers be detected at an early age?
See, as you said, the underlying disease of cholesterol deposition, atherosclerosis, can be there for many of us to some extent, in some to a larger
Right.
extent, and you might not even be aware of it. When a trigger happens, a trigger is something which causes a small rupture of the plaque and exposes to the dangerous scenario I told you. What are the common triggers? The three commonest triggers. One is unaccustomed physical exercise. So normally, if someone who has been sedentary suddenly one day
Correct.
starts doing a marathon, you see that youngsters, 20, 25, they go on a marathon one day without proper preparation and they land up in
Correct.
trouble. Then I call something called the gym syndrome.
Yeah.
Someone who has not been active at all suddenly goes to the gym and starts doing heavy weights suddenly, and then they come straight from there to the hospital. So any unaccustomed physical activity is not good.
Right.
If you want to take up a physical activity program, do it in a graded way, initially under
Mm.
supervision, and gradually build it over. Of course, extreme of physical stress is always a small additional risk of getting a plaque rupture and heart attack. The third is the trigger. The second trigger
Right.
is, apart from undue physical activity, is an undue emotional stress. Sadly, we all have to go through it at some part of our lives. If you have a
Yeah.
resentment or a brooding type of emotional stress, somehow that is making people prone for plaque ruptures. The third is again a very common trigger, that is the infection. Any simple infection, throat infections, viral infections, including COVID for that matter, any infection can set in an inflammation. And for the next 2 to 3 weeks, one should be careful in avoiding other triggers. At least you should be careful not doing any heavy activities. So infections can trigger the plaque ruptures. So unaccustomed physical activity, undue emotional stress, and infections. Beware. These are the triggers which we have some
Perfect.
control in avoiding.
That's absolutely wonderful. Thanks. I think all of us have emotional triggers are just literally everyday process, I think, at some level, with so much stress going around. And even the other two, I think one, even I need to keep all of this as such. Um, the next one is, are there any challenges in treating in young people?
Yeah, the biggest challenge, Vidya, is the late diagnosis, because you won't expect a perfectly normal, healthy person, 30, 35, doing gym work or going around doing everything normally. Suddenly, some discomfort happens, and then they think it is a heart. They won't. It is not possible. That's the reason I said the tragedy of first heart attack. It almost always strikes the previously healthy people till that day. So the delay in diagnosis is a big issue. And
Right.
you, and in fact, the other thing is the misconception among the public that a heart attack means severe pain, which is so struggling, it's trapping. It's not. Most of the heart pains, we call it pain, but actually it's a slight discomfort, a subtle discomfort, a small sensation of burning or compression in the throat or the chest or the shoulder or the back, anywhere between the jawline and the belly button. The severity of the symptom is not
Oh,
related to the severity of the cardiac problem. This is one message I would like to send across. If it is a severe crushing pain, it is unlikely to be a heart attack. In fact, the subtle discomforts in the
oh,
appropriate suspicious areas is what should make one go to seek the attention of the doctor. If cardiac issues are ruled out, then it's well and good. You know, it is a simple gastritis or a simple spondylosis. But These non-dangerous diseases should not be diagnosed without ruling out the most catastrophic disease. So that is the biggest challenge in youngsters. The second biggest challenge I can say in heart attacks in youth is their pathophysiology is slightly different from the elderly. So many of the times it is a plaque which has ruptured, a lot of clot will be there. So you treat them slightly differently, like in the older people. And if they come quite early, sometimes we just suck out the clot. We give some clot busting drugs, and we can even do angioplasties. As you know, the main treatment for an
Yeah.
acute heart attack is taking them to the cath lab, doing a primary angioplasty and stenting. In these youngsters, sometimes we can get away with just a plain balloon without stenting as well. So we have a different strategies because we'll do the angiogram, we look at it, we know the pathophysiology is different, we can adopt the techniques to suit them. So this is not a challenge as such, but we have to vary and adapt
Mhm.
to the requisite scenario.
Absolutely. And talking about the three triggers that we just said, the physical, emotional, etc. Can these triggers also be detected at a young age, in an early stage, maybe?
The triggers are what are under our control. See, in fact, the wisest way of preserving your health and avoiding heart attack, I keep telling everyone, is imagine that you have some mild heart disease, somewhere some mild plaques are there. Make sure at least you can avoid the triggers. Every time you are angry or you are
Right.
resenting or brooding, you have to say that it is not a heart healthy behavior. So the word is heart healthy behavior, heart healthy emotions, heart healthy diet, heart healthy attitudes. If you think of it and if you do
Wow.
your life in that way, this actually then it's almost like what Lord Krishna says in Bhagavad Gita. It comes to that.
Wow. So, okay, these are the 4 points to be heart healthy, really. Perfect. Tell me, are there still reasons that, 1 second. So, are there any special reasons for young people to get heart attacks?
Yes, as I said,
There are,
see,
obviously.
the one, of course, the genetic history is very important, as I said. But as of now, we deduce
Correct.
it only by the family history of premature disease. The other issue is there's some other chemicals in the blood like homocysteine, which if they are high, they can precipitate heart attacks in these people. Some of the youngsters, especially women, they can be having disorders like rheumatoid arthritis or SLE, the inflammatory disorders, which can make
Oh,
people more prone for these disorders, psoriasis, for example. And as I said, youngsters are more prone for extreme physical activities and this age group because of their hobbies, and that can add a small additional risk as well. And of course, if someone is doing a binge smoking or using drugs like cocaine,
mm.
they can constrict the cardiac blood vessels and cause heart attacks, which is again quite rare, but we do come across youngsters coming with heart attacks following a cocaine binge. There are issues which are specific to
Oh,
this subset.
wow. Okay. And about young women. So, do heart attacks happen in them as well? I mean, I'm sure they do, but aren't they protected by, the estrogen hormone?
Yeah, that is the general thinking, and is it true as well that once you are in the reproductive age group, the heart disease incidence is quite low. It is a protective phenomenon. However, if you have one additional risk
Correct.
factor, for example, say a slightly increased blood sugar, it need not be even frank diabetes, a little bit of elevated sugars above normal, that itself takes away the 10-year advantage. Normally, we say women in the reproductive age group, they have a
Oh,
10-year later only they get diseases, heart disease compared to men. The 10-year advantage is wiped out once you have additional risk factor like diabetes or very high cholesterol.
oh, okay. So we have a question from Miss Karedi Shweta. If there is pain in the chest that is not frequent but comes and goes away, is it point of concern or it would be gastric related issues, sir? Um, she also has shortness of breath and dry cough after COVID vaccine. Could could that also be
See,
related to a health problem
this is a
or a heart
biggest
problem?
challenge because the heart disease related pain, it is a fine art because it's only from deduction of the pain only we have to assess whether it is a cardiac or not. For the patients and for the general public, the usual clue we tell is if some discomfort is brought on by effort, and the moment you take rest it disappears, and again it is reproducible, again you do some effort, you climb the stairs, so you get something over here, and then again you stop, it disappears. That type of reproducible effort brought on discomfort is probably the heart. If something is happening at rest, continues to be there for hours together, for days together, for months together, when you walk, nothing happens to that, that is not cardiac straight away.
Oh, okay. Okay. So here's the next question that we have from Mr. Mahesh Joshi. From the last 1 year, I'm having pain in my left chest, neck, and arms and fingers. The pain keeps moving, but I even go for swimming, exercise 4 times a week, but still the pain comes and goes. Please help.
See, if it is not reproducible with every effort, it is unlikely to be cardiac. But if you are in the age group where this disease is more common, if you have additional risk factors like, say, high pressure, cholesterol, stress, or smoking, it's better to get an evaluation. Nowadays, it's very easy to diagnose heart diseases with
Yes.
simple basic tests, like a small echocardiogram, blood tests. Or there are some tests which are available nowadays called the troponins, which even in normal people, if you find them to be higher than the normal range, you know that they are prone. And there are several ways to know whether it is heart or not. It's better to have one checkup and then rule it out and then carry on with healthy activities. At this juncture, I think I should highlight the fact that getting a clean check from the cardiologist that your heart is normal now is not the end of the story. It should be a motivating factor for you to adopt a heart healthy lifestyle. You have to prevent it forever.
Absolutely. Absolutely. And just talking about this test that you were saying, so how often should a person take this test? And is there like a age that you should take it after, say, 30, 40? Anyways, we're talking about youth right now, but what is like the cutoff? When are you seeing these heart attacks? So tell
The
us more about that.
basic uh, illness risk factors, a sugar, a cholesterol, or a homocysteine, or a blood pressure measurement, of course, is recommended once you are 25 or so. Maybe if everything is perfect, maybe you can check them once in 3 or 5 years. You don't have to repeat them at all regularly. But if there
Oh,
is a change in the symptom, if you get a symptom, definitely you should go for an opinion. Otherwise, once in 5 years, maybe if you're perfectly healthy.
okay. Once in 5 years is sounds doable, and actually, it's a must for everybody to take care of your heart, right? So the next question from Mr. Jesselvin. Does high triglycerides level increase heart rate or causes sinus tachycardia?
Does high triglycerides, is it?
Yes,
Yeah. See,
increase the heart
cholesterol
rate
has
or
several components. Triglycerides, LDL, so many technical words are there. The good cholesterol, the bad one, the ugly one. So overall, cholesterol is a separate entity altogether. Tachycardia, heart rate increase, all that, they are not related directly to that. But if your cholesterol issues have already gotten you into trouble of established heart disease, yes, you might get the other issues. But I think one more issue I think we should highlight here: people should not get panicky looking at these lab reports and all that. You leave that opinion to the doctor, because many a time we do see the reverse
okay.
issue as well. People do these tests and they keep go on repeating these tests again and again, and for every small pain they get worried about heart disease. I don't think one should fall into that trap of fear and anxiety. What is needed is a clear wisdom about what is important and what is not important. And if you are reassured by your physician, I think that should be the end of it. You should not. Your only job should be to pursue a healthy, heart healthy lifestyle, day in and day out. That should be your only priority.
I think, doctor, I'm going to introduce you to my father because I think even if it's a pain anywhere around, he says, okay, this is going somewhere else because I think it's the mind that does these tricks. And
Yes.
my father gets so hyper. So I think you are the right person to introduce him to. But while moving along, we have the next question from Mr. Mohan Vadvani. And he says, after Corona, I'm facing irregular heartbeats, blood pressure, blood sugar, sleeping insomnia. My age is 78 years, weight is 72.5, height is 73 centimeters, having 7 stents in my body. What should I do to prevent heart attack?
See, as we said, prevention is quite simple. I usually tell my patients there are only 6 ways of preventing heart attack for those who already have the disease. 4 are in your hands: appropriate heart healthy diet, good regular physical activity,
Right.
habit modification. If you're a smoker, don't do that. Stress reduction. These four, you do it on a daily basis. Two, I can help you with the preventive medication.
Right.
There are four medicines which are important for preventing heart diseases from cropping up again. And I can also advise you to adult vaccination called the flu and the pneumo vaccine, which can to some extent reduce the chance of heart attack and stroke. So majority of prevention is a responsibility of the person who has it. So we can only guide you, but you have to do it on a daily basis.
Right. Absolutely. So, what kind of exercise would you recommend for just generally people to keep your heart healthy?
Very, very important question. I think this is where there are several issues involved in activity. Normally, what we call as a heart healthy activity is a 30 to 45 minutes of moderate aerobic activity done at least 5 days a week. If you can do all
Okay.
the 7 days, it's good. So 150 minutes per week of moderate activity. If you can do a little bit more vigorous, 75 minutes is enough. But make sure it is not extremely physically strenuous activity at all, because it can lead to trouble. We use the word exercise hormesis. Hormesis means beyond a certain limit, a good thing can turn into bad, and it applies to
Right.
exercise as well. So, a good,
Correct.
decent, moderate
Mm.
activity. And I personally feel that that activity should have the mind involved in that for relaxation and to accrue the benefits of the activity. It is what is important is the relaxation. It is not just the physical activity, it is the mind
Correct.
involved in that. You could do whatever you like. You could do walking, you could do swimming, you could play games, you could just simply do some dance or music or yoga, whatever you want, whichever form. But let it not be extremely
Yoga, just
strenuous,
fine.
and let it be very relaxing.
Right. So yeah, I think there's a new trend that's actually come in where they do HIIT hit sort of a training, which they sort of just 10 minutes of bursting activity, like take your heart to the highest level and then come down because apparently that makes you lose weight and all of that. So obviously that is not heart healthy then, right? This is the new trend in the youngsters these days, is what I get.
See, I think there are certain activities which are helpful for the appropriate muscle. So, if you're doing 20 kilos weights for the biceps muscle, it is only helping that muscle. We are talking here about the most important
Right.
muscle of the human body, the heart muscle. It has a different healthy
Right.
activities. So, if you are looking at the most important
True.
muscle, how to build activities for that muscle, it's not by doing these heavy weights or extreme gym work. A mild hit HIIT is a good one for the heart. If you have to adapt it, it has to be very gentle. Maybe a 30-second fast walk or
Right.
a small jog and a 2 minute slow walk. So it has to be modified for heart friendliness. For the rest of it, of course, if someone is
Correct.
into marathons or as a hobby, someone wants to do something, of course, that's a different issue altogether. But when it comes to preserving or encouraging the heart to be perfect and healthy, you have to modify it to suit that. That is the biggest and the most benevolent muscle
Right.
we use.
100%. So I'm going to take the next question, and that is from Rafat Siddiqui. What precautions regarding their heart should be taken by patients suffering from hyperthyroidism?
See, hyperthyroidism is a disease where the thyroid hormones are in excess, and if in the initial untreated phase, it will cause damage to the heart muscle. It can also cause fast heart rates and something called atrial fibrillation. All these can easily be tackled once you treat the thyroid problem, and there are a few medication which will help the heart to return to normal. Almost always, the heart recovers fully.
Oh, that's wonderful to know. Absolutely. So that answers your question, Rafat. Moving on, we have Vandana Krishnan who is asking, what first aid should be given if heart person having chest pain or being breathlessness during conscious and unconscious?
See, if you are
Mm,
sure that it is a cardiac pain, especially for those who already have this issue, there is a tablet called sorbitrate we must have advised, which is a tablet to be kept under the tongue, and it gets dissolved. It improves the blood flow. This is for those who already know the heart disease. If you are someone who never knew the heart disease, and if you are a physician or a doctor or a cardiologist, of course, you can know what it is and you can use that. But for the general public, it's very difficult to know whether it is heart, and we cannot prescribe any preventive tablets to be carried around unless you already have the established disease.
Right.
So it's better is the wisdom is to seek a medical opinion with your family doctor or nearby doctors. And if you're quite suspicious that it is important thing in the heart, like a heart attack, better go straight to a hospitals where there are facilities for tackling heart attacks. In fact, the entire country, if you see the medical infrastructure, we classify it as heart attack treating centers and heart attack referral centers. You can divide the establishments. There are some the hospitals which have
Right.
24/7 365 access to cath lab for doing an emergency angioplasty for heart attack. They are called the heart attack treating centers. If you are having suspicion, better if the such hospital facilities are there, always go there. About 10% of our population
Right.
have access to this, and they should have the wisdom to choose the right thing.
Absolutely. Well said, doctor. So the next question is from BP Singh. After angioplasty, is there a chance of heart attack in spite of controlling all the risk factors? Please reply.
There are two issues here. When we do a bypass surgery or an angioplasty, disease can come back again inside the stent in a minority of people, 4% or 5%, or in the bypass grafts. But the biggest tragedy of this disease, of coronary disease we call it, is this is not a curable disease. We are only trying to control it. So the fact that you have developed a block in the first instance
Oh,
means that you are prone for getting these blocks in other areas as well. So this tendency will be there, and in fact 20% or 25% of times new blocks erupt in the so-called normal areas of the body. That is the reason for heart diseases we always tell prevention
oh,
lifelong. Even though we have corrected the critical block, to prevent disease from happening, you have to be on a lifelong. That's the reason we prescribe lifelong medication and vaccines, and we insist on healthy lifestyle forever. Prevention is very important.
right.
A controllable disease, a modifiable disease, not curable.
Okay, controllable, modifiable, but not curable. I'm going to ask you about the diet very shortly, but there are so many questions that are coming in, so I'm going to take those first. So the next question is Mr. Sri Hari K is asking, does a person who has undergone gynecomastia surgery has a chance to get a heart attack?
That gynecomastia surgery per se has no relationship to heart disease. But any surgery, any surgical intervention for any disease also. Nowadays, of course, it's a practice to check for any underlying heart disease before you get a clearance. Gynecomastia has absolutely no relation to heart disease. That's it. That is a form of a different
Okay.
surgery.
Well, there you go. That's a question answered very well. You don't have to worry at all. The next question is from Shweta Reddy again. Please elaborate on the methods of cholesterol control.
See, this again is a very important topic for the general audience. Cholesterol, there is in
Correct.
this, we call it the era of WhatsApp. In fact, we call it as the International Journal of WhatsApp, where people get piecemeal wrong informations and then apply it to their health. See, cholesterol is an important
Right.
aspect of the human body. Body makes cholesterol out of anything. You don't have to take cholesterol in diet. It makes out of anything because it is important. And the body, as usual, is a wonderful machine. It makes more cholesterol than is needed and it throws away the extra. That is its mechanism. If there is an imbalance, if it is not able to throw out the extra, then the cholesterol gets accumulated. So, what we encourage you is
Right.
avoid too much of oily fried stuffs. There are some things in the diet which can get converted into cholesterol in the body. It need not be cholesterol by eating. In fact, none of us take that much cholesterol in the diet. In fact, as you know, cholesterol is there only in animal kingdom. A pure vegetarian food has no
Right.
cholesterol. If someone says my groundnut oil has zero cholesterol, it is obvious. These are all advertisement gimmicks. No vegetable kingdom thing has cholesterol in it. So it's not the cholesterol that is causing or that you take in that causes a deposition. It is the saturated fats, the trans fats, the other forms of food which are
Right.
easily converted into cholesterol inside the body. So you have to avoid saturated fats, too much of red meat, too much of egg yellows or seafoods. You reduce that. It need not be a zero thing. The one thing which we insist on zero in terms of heart disease are only two things. One is smoking, and the second is deep fried trans foods. When you deep fry the oil, it becomes a trans fat the trans will get deposited in the blood vessel lining easily. So avoiding unhealthy diet, it's not, again, not a big thing, everyone knows about it. But what is more important is you
Correct.
have to get in the healthy diet as well. Avoiding the wrong is not the end of the
Ha,
story.
that's what I wanted to ask.
Getting in the right things, in fact, as I told you in the interheart study, not having 5 portions of vegetables and fruits in your diet per day was considered one of the risk factors for getting into heart attack for the first time. So 5 portions of fruits and vegetables per day is we call it the rainbow diet, a colorful one. And if you take all these societies
Yes.
in the world where people have lived into their 90s and hundreds with good health, and heart attacks and cancers are lesser, it is always a rainbow diet in moderation, taken in a right way. So that is the importance of diet.
Right.
Nuts, berries, they're all very important as well. And
Correct.
dairy,
So
there
fruits
is a
and vegetables,
controversy. Yeah, there's a misconception
yes.
that milk and dairy items might be harmful. No, dairy and milk is good, unless if, of course, it is a too fatty a milk, you can reduce the fat content of it. But overall, dairy foods are good. They are not a problem for heart patients.
Right. So basically, you're saying cut down on the fried, cut down on the oil, cut down on the trans fats, and that's most important, along, of course, with smoking as well. Um, Absolutely right. And get in the rainbow in the diet. This is what my thing is, eat the rainbow every day. So,
Yes,
well, I hope that answered your question, Shweta, and also answered mine too, doctor. So, thank you for that. The next one coming in is from Soumya Narayanan. I'm 41 years old and I've felt frequent NSVT. Is it dangerous? I took CT angiogram, but heart is healthy. Then took Holter monitoring. It shows 12.5% frequent NSVT.
see, this is a different disorder than from heart attacks. This is an electrical problem of the heart. As you know, like in any work of art, heart also has got its muscle, its valves, its blood supply, its electrical wiring system. These are electrical disorders. And from the way you are describing, this appears to be the common, harmless, benign, irregular beating of young women. We call it the RVOT ectopics, and from the way you were describing, but I should consult the doctor once, and most likely it will be something which is harmless and benign, and they might reassure you and might give you one small dose of beta blocker. The way you were describing seems to be very harmless.
Okay. So I hope it is really harmless for you. And moving along, we have a question from Mr. Biju Vincent. Doctor, I'm Biju Vincent, male university assistant professor. Had a heart attack in August 2021. Had no BP, no sugar, no cholesterol, um, not overweight either. Had been drinking, nor smoking habit. How does the stress play significant role in heart attacks? Now, this is a question from me as well to you, doctor.
See, as we said, not having high BP, cholesterol, sugar is one part of the story. But as if we take the wellness score, were you taking 5 portions of fruits and vegetables every day in your diet? Many people fail. Were you doing 30 minutes of aerobic activity every day in a relaxing way? Many people fail that test as well. Are you avoiding the triggers of undue emotional stress? Again, many people fail in that. So we are failing in some of the areas which we are not analyzing it. This is very important, and these things are not measurable by any blood test. This is a very simple history we all are aware of. As we said, if we question ourselves, many of us will
Absolutely.
fail on these counts, and that is the reason why this disease keeps coming on and still continues to be the largest killer disease of the entire humanity, including our own country. But the good part, you
Right.
can, once you get the wisdom, you can implement a heart healthy lifestyle, and then you can control 90% of the chance of reoccurrences.
Right. And I think there's a little thing that I'd like to add on here is that something that has changed my life. I am a yoga practitioner and a yoga teacher, but I think something to a point of about 10 minutes to yourself as a meditative practice, if you can do something, that'll also bring the stress down so much. What do you think, doctor? Because I feel like it's changed my life drastically. Because stress is really not avoidable with the kind of deadlines and things that we live in these days. So how do we just sort of minimize it and make ourselves a little more conscious about it. Um, What are your thoughts on it, doctor?
Another point of area of specific special interest for me as well. I know that you are an avid
Nice to
yoga
know.
practitioner, and I've been following yoga for the last 12 years or 15 years or so, and I love it because, as you said,
Wow.
this is one thing which any activity which keeps the mind and the heart together and relaxed. That type of physical activity will help the body and as well as the mind, and psychosocial stresses are reduced. In fact, yoga is one of the beautiful ways of keeping physical activity. In yoga, as you know, all physical activities we are talking of are just not for the muscles or for the cardiac activity. There's an element of balance maintaining, there's an element looking at the posture part of it, and there's an element at relaxation part of it. Yoga encompasses all the aspects of physical activity. There are very few forms of activity which do that, and I am a real big fan of yoga as well. I'm a real living example of a
Wow.
continuous persistent effort at yoga.
I'm so happy to hear that, doctor. And you guys, all of us who are watching you, this is coming straight from doctor himself. I think I do my bit in every possible way to propagate a yogic lifestyle, mind and body. And here we have one of the best experts from the industry telling you that, this is something that he practices, and that makes my heart so happy. I cannot even tell you right now. So thank you so much for this, doctor.
Amazing, excellent.
And yes, please take this away as well, viewers, from Dr. Reddy. Moving along, um, there's the next question that I'm going to take. Art of dot Sai Krupa. Okay, that's the name. Miss Sai Krupa, I think, is asking this. My age is 46, working as a professor of vocal music department. My echo result is mild tricuspid mitral valve regurgitation. Does it give pain while I'm singing? Give some clarification of this should concern my heart health. If this should concern my heart health. I'm sorry if I, pronounced it a little crazy because obviously I'm not used to these words.
So again, see, as was again, this is an area of should be emphasized for the general public that don't read the reports and get panicky about them, because there are several nuances in these. For example, a mild regurgitations like what you have mentioned, they could all be a part of normal study.
Hmm.
In fact, they let the physician see and then say whether it's normal or abnormal. Mostly, whatever you have read out now, it indicates only a normal heart. That mild has no significance. One should not imagine things. I think
Right.
in the
Oh, okay.
this era is very important because one should not get into a trap of fear. The trap of fear is what takes away the joy of life, and the joy of pursuing a healthy lifestyle should never be tampered with.
That is so well said, doctor. The trap of fears takes away from the joy of life. That's another line I'm going to give my father today, though, for sure. Okay, my next question is from Mr. Saikatkar. On uh, in April 2021, I got chest discomfort and breathlessness. I'm a non-smoker, non-alcoholic. Upon diagnosis, MRI, my doctor diagnosed me two arterial blocks, 99%. I have huge emotional stress in my life.
Yes, this is the real tragic part of the problem we are dealing with today. One, of course, treatment part. Nowadays, we can diagnose it quite well. If you come early, we can treat it so well with the angioplasty and stenting and whatever is needed, appropriate scenario, and make your heart back to near normal. You can lead a normal life after that. But the sad part, how to prevent them from happening. For those who already have it, it becomes easier to convince them about a healthy lifestyle. As I said, avoiding the unhealthy part is one part of the story, but doing the healthy part day in and day out for the rest of your life, that is where actually the you should not look it as a
Yes.
punishment. It is a joy. That is where joy lies. The joy lies in adopting a healthy lifestyle on a day-to-day basis. And for those who already are totally normal, they never had heart disease, a point of small caution is we are the sitting ducks. I keep telling that. All healthy people, we are the sitting ducks for these disorders because this disease is a common disease. The commonest statistical disease affecting a 30 or 40 or 50-year-old in our country is this. And so know that. Keep that in mind. Don't use it as a fear, but use it as a motivation to pursue a lifelong healthy life.
Absolutely. That's absolutely so true. So the next question is from Mr. Prasad Ranga. I'm 38 years old and I have one stent put in my heart, 6 months going, but still pain in shoulder, both shoulders continue. Is it related to heart pain?
See, this is again another trap. Once you experience a heart pain, you will start imagining things, and then even the smallest of the non cardiac pain might push you into a syndrome of fear. The way we say that is first let your doctor see. If he is sure, if he reassures you that it's not from the heart, then I think you should forget about that symptom. Many a time there will be muscle pains. Sometimes medicines might cause some amount of gastritis or mild muscle pains. They all should not cause that syndrome of fear in you. Another small trick we tell people who already had a heart attack is to remember that pain what they had during the attack, the so-called pain or discomfort or whatever burning. Only such type of symptom, if there is a recurrence, you worry about it. All other symptoms, you just ignore it.
Absolutely. Moving on, we have a question from Mr. Rudri. Can you kindly single out the most critical lifestyle factor as well as pathological factor? Is lipid still a factor after it has been removed from the list recently?
I think very important point you raised. If you ask in the order of importance, the first is genetic, that is the family history of premature disease, coronary disease. Second most important is high cholesterol levels in the blood. Somewhere the misconception due to the WhatsApp era that cholesterol has been removed. Cholesterol in the diet as a risk factor is not the truth, as I told you, because body can make cholesterol out of anything. You take sugar, it will convert into cholesterol. You take protein, it converts into cholesterol. So you need not take cholesterol for the cholesterol to build up. The second most important risk factor for these diseases, next to family history, is high cholesterol levels in the blood. High cholesterol levels in the blood continue to be the most important risk factor, and fortunately for us, easily modifiable. We've got wonderful drugs now. Statins are there. There are 5 groups of drugs which can control this, which can make this cholesterol issue very harmless. So take those medicines. Don't get wrongly spinned by the so-called diet cholesterol has been removed. The dairy industry, whatever cholesterol is. In fact, if
Wow.
you take the diet cholesterol is very, very negligible and nominal. In fact, for pure vegans, there is zero cholesterol in the diet. So there is no cholesterol at all. For vegetarians, the only cholesterol can come from a little bit of milk and curd items. So it is extremely small. But how they get the cholesterol in the body, it needs the body makes it. So blood cholesterol is the most important modifiable risk factor for this disease. Family history, you cannot do anything about it. So if you ask primum risk factor primum, blood cholesterol.
So now that my brain is thinking, I want to ask you. So okay, so it's not just about what we eat as such. It's something that the body that is doing that might create cholesterol, which is in excess that might cause this. So isn't there anything that we can do to check that? I mean, it's just
Yes.
like okay, it's like Ram Bharose says, it can happen for you, it won't happen to me or somebody else or something like that. So
Again,
okay, is there any way we can
very,
check
very
this?
thought-provoking question. See, one is we have the knowledge nowadays that certain types of foods get converted inside the body to high cholesterol. As we said, trans fats, deep frieds, saturated fats in a
Correct.
high amount, they get converted. So we can push them out and minimize them. The second is if you improve the metabolic profile of your system by regular physical activities, somehow the body's capability to excrete the extra into the out of the system is improved. So that in fact there is a word we use called metabolic syndrome. When your metabolic profile is deranged, everything gets deranged. Your sugars start going up, your cholesterol start going up, your uric acid starts going up, thyroid problems
Right.
start. So this is all a part and parcel of one important common problem called deranged metabolic profile. Of course, some amount of it is modifiable, but for cholesterol, we have wonderful drugs which what they do is they just make the liver excrete that extra cholesterol out into the stools. So that is how the pharmacology has been made.
Okay.
So this is one of the greatest inventions of
Okay.
20th century, the statins. People have misconceptions that certain drugs cause attacks, cause muscle pains, and all this is a benefit for the industry. They are all probably
Memory
extrapolated
loss.
with lots of the so-called fake theories and yeah, you imagine more into that. the so-called conspiracy theories.
Right.
One should have the wisdom to know what is the medical reality. WhatsApps, nets, everything has got wonderful information as well, which is useful for the public. You should just know the difference between what is the right wisdom and what is not, what is the fake or the conspiracy theory. Go for the right thing. There are several medical sites which will give you enough and true knowledge, and use your wisdom as well.
Correct, exactly. So again, continuing, I think Mr. Rupak also wants to ask, how do we know if the heart muscle is not strong? Do we have
See,
a
the
way to know
pumping of
it?
the pumping of the heart is a quite easy thing to measure. Just an echocardiogram, which is a screening tool of the heart, will tell you how the muscle of the heart is, how the valves are working. That is a small 5 minutes test to know the pumping capability of the heart. So each part of the heart's function, there is a one test appropriate for that. These are all quite simple tests to carry out.
Correct. Another question from Mr. Binod Agarwal. Is it possible to know if by test, if any, one had a previous heart attack? Is it possible to know by test if anyone had previously heart attack?
Yes. See, a heart attack, most of the times, once it happens, it leaves the mark on the ECG and on the echocardiogram. We usually say 98% of times.
Right.
Extremely rare, a very minor attack might not show later on, but most of the time, it is an unchangeable blemish. It will be there. It can pick it up. So you can always find out. Sometimes people come with a silent heart attack. We can pick it up on ECG and echo. You can always pick it up
Right.
when you do these two tests.
Okay, this is something that I wanted to ask you. So I have something like my heart just starts beating very rapidly at some point and then it comes back to its normal self. It's been happening years. Sometimes when I used to go to down shows and things, it happened a little more and then came back to normal and then I'm fine. I mean, nothing happens for 5, 10, 15 days and then some days it just happens twice a day as such. Do I have to worry or do I not have to worry? I mean, I'm
So
not
this
worried,
is
but
yes,
as you say.
this is indication of a perfectly normal heart. A perfectly normal heart has to
Ha!
increase its heart rate whenever it needs to increase the heart rate. You are in either physical stress or emotional stress, or you are emotionally stimulated or excited about something. It has to go up. So that is normal, and then you cool down,
Right.
it comes down. That is indicative of the perfect normal autonomic balance of the heart. There are certain diseases where this is not possible, and then we advise certain therapies and treatments for that. And in fact, even skipping a beat,
Okay, so
sometimes
sudden.
people feel that a small they skip a heartbeat when they are very very excited. That is again a part of the normal thing. You don't have to worry about that.
Okay, so I'm going to take one last question for you, doctor. Mr. Deepak Agarwal is saying, I'm 60 years old. I got my angioplasty 15 days ago, but till today, I feel discomfort near my heart and chest pain. Should I be worried? What should I do?
So I think, see, post angioplasty in the first 1 to 2 weeks, people can feel a different sort of discomfort here because the stent is stretching the artery. For the first time, something inside the blood
Right,
vessel is stretching it. It will go away. If it is a constant dull thing,
right.
usually it is a harmless feeling and you can just ignore it. But always, your physician must have seen and then reassured you as well. So once you have been reassured, I think you should not nurture that symptom of fear anymore. That is the important thing to think of. Concentrate on the positives.
Absolutely, doctor. It was absolutely concentrate on the positives, guys. So I'm going to give the stage to you, doctor. I want you to tell us your top tips preventing or keeping your heart health.
Yes, we have discussed it all. Thank you, Vidya, for discussing this wonderfully important topic. My parting words: the human body is a fascinating work of art, and heart its centerpiece. And heartbeats are what constitutes life. Be loving to your heart, nourish it with healthy diet, cherish it with regular physical activity, good healthy habits, serene thoughts, and joyful emotions. Get heart smart. Be loving to your heart and let life flourish.
Very well said, Doctor. It is such a pleasure talking to you and my honor. We would love to have you back at some point again. And in the meantime, from myself, from our team, and from all of our viewers, we really, really want to thank you. Very, very
Thank you
grateful for
very much,
all the
Vidya. It was
information
a
and all the
wonderful thing.
insights.
I'm really happy to be a part of this show. I enjoyed it. Thank you.
Thank you so much. Thank you. Well, guys, now it's Quiz time. Hope you guys are ready. And let me give you a tip. Some of the questions will be easier to answer if you have the Apollo 24/7 app on your phone. So here goes. Answer the questions over the chat. Winners' names will be announced at the end of the show. Winners to mail their contact details at marketing@apollo247.com and the gift vouchers will be shared with you. So, without any delay, here are my three questions for you. Um, Question number one. When is the World Heart Day? Once again, when is the World Heart Day? Question number two. How many chambers constitute a heart? Again, how many chambers constitute a heart? Question number three. Which premium membership plan of Apollo 24/7 provides you with benefits like free delivery of medicines, 24-hour emergency doctor on call, and many more? Once again, which premium membership plan of Apollo 24/7 provides you with benefits like free delivery of medicines, 24 hours emergency doctor on call, and many more? Well, so quickly put your answers on the chat. But before we move on to announcing the viewers, I just want to make sure that all of you have gotten your COVID vaccines by now. And if you haven't, please book your vaccination slot on the Apollo 24/7 app by scanning the QR code on the screen or just walk into your nearest Apollo vaccination center to get your jab. What's more, by getting your second dose at Apollo, you can win exciting rewards like 150 rupees off on your first virtual doctor consultation, 10% on pharmacy doctors, free Ghana membership, free Lenscard Gold membership, exclusive discounts, and much more. So make sure you encourage everyone around you to get vaccinated as well. In case you have any questions about vaccination or any other health concerns, you can use this special coupon code HH247 to get rupees 199 on your online consultation and 15% off on medicine orders placed at the Apollo 24/7 app. Well, I'm not going to make you wait any longer. So here are the names of our winners. 1. Chesta Mishra, 2. Satya Nadigam, and 3. Bhanu Prakash. Congratulations to all of these winners, and thank you so much, all of you, for joining us today, for participating, and hope you guys have found the information shared useful and would follow the amazing tips shared by Dr. Reddy. We want to say goodbye here, and of course, we will be back with another important topic and an Apollo expert next Sunday at 11 a.m. So stay tuned and keep wearing that mask to stay safe. Goodbye and God bless.